Yes, great. Good afternoon to all. Let's start. It's really a pleasure for me to be here, and it's really an honor to chair this session that addresses reducing the risks of climate overshoot. So I thank the Climate Overshoot Commission for the invitation for me to be here, and I also congratulate the Commission for the launch of the policy paper developed to address the grave public health risks associated with climate overshoot. For those that are not very acquainted with the Commission, it's an independent group of 12 global leaders who have come together to consider the potential benefits, opportunities, and risks of a wide range of climate action approaches to reduce and manage the heightened risk of overshoot. For the purposes of the Commission, overshoot occurs when global warming exceeds 1.5 degrees Celsius above pre-industrial levels, causing cascading impacts on human and natural systems, including on the public health systems worldwide. So according with the scientific assessment carried out by the Intergovernmental Panel on Climate Change, the IPCC, overshoot of any given level of warming results in more adverse impacts, some irreversible, and additional risks for human and natural systems when compared to staying below that warming level. Risks grow with the magnitude and the duration of the overshoot. So the Commission developed the CARE Agenda, C-A-R-E, created having in mind the urgent global action needed to address the challenges overshoot is expected to have on health risks. It offers an integrated set of recommendations for achieving a safer, cleaner, and more equitable world to all through cutting emissions of greenhouse gases, so that's the C, adapting to the unavoidable impacts of climate change, that's A of CARE, and removing carbon dioxide from the atmosphere, and exploring solar radiation modification. So that's the C-A-R-E. So at this session, we aim at presenting the Commission policy paper launched today. I will give a brief introduction to the key policy recommendations in the paper, and then continue the session, setting a panel with 4 distinguished panelists who come from very distinct backgrounds. So let's start. Where do we stand at present in relation to limiting the global mean temperature increase and the efforts to avoid overshoot? Well, Copernicus provides monthly data to the pre-industrial reference period. When I'm talking about reference period, I am making reference to the period of 1850 to 1900. So Copernicus provides this monthly data to the pre-industrial reference period of global surface air temperature anomalies that indicated in last August a warming of 1.51 degrees Celsius above these pre-industrial levels. However, the IPCC acknowledges that the global surface temperature in any individual year can exceed 1.5 relative to the reference period by 2030 if the central estimate of 20-year average global surface warming is used, which is the approach of the IPCC. So it differs from the Copernicus because Copernicus is indicating 1.51 in August, it's a month, whereas the IPCC takes the central point of a larger period of normally 20 to 30 years. And in 2019, the IPCC provided a warming of approximately 1.1 degrees Celsius higher than the reference period for the period 2011, so 2020. So there are different ways to assess. So let's not get panic when we see Copernicus saying that we already be above 1.5 degrees Celsius. It's a monthly value. So the important point raised by the IPCC is that any increase in global temperature is projected to affect human health with primarily negative consequences. So lower risks are projected at 1.5 than if we have a 2 degrees Celsius increase for heat-related morbidity and mortality, and for ozone-related mortality if emissions needed for ozone formation remain high. Risks for some vector-borne diseases such as malaria and dengue fever are projected to increase with warming from 1.5 and 2 degrees Celsius, including potential shifts in their geographical range. So overall, for vector-borne diseases, whether projections are positive or negative depends on the disease, on the region, and extent of change. Lower risks of undernutrition are projected at 1.5 than if we have a warming of 2 degrees Celsius. And incorporating estimates of adaptation into projections reduces the magnitude of risks. Heat waves, water scarcity, food insecurity, infectious disease spread, and mental health impacts are projected to worsen with climate overshoot. So regardless of the warming level at present, there is evidence that human-induced climate change, including more frequent and intense extreme events, has already caused widespread adverse impacts to nature and people and across sectors and regions. The most vulnerable people and systems are observed to be disproportionately affected, and IPCC provided an estimate of around 3.3 to 3.6 billion people living in contexts that are highly vulnerable to climate change. So in the context of climate change impacts, the IPCC notes that risks result from dynamic interactions between climate-related hazards like droughts, like floods, with exposure and vulnerability of the affected human and ecological system to the hazards. So climate change adversely affects human health by increasing exposure and vulnerability to climate-related stresses and decreasing the capacity of health systems to manage changes in the magnitude and pattern of climate-sensitive health outcomes. So the Commission policy paper highlights that addressing the risk of climate overshoot requires a multifaceted approach that integrates health considerations into climate action. By increasing climate finance, strengthening governance, phasing out fossil fuels, decarbonizing health systems, and carefully researching solar radiation modification technologies, we can mitigate health risks of impacts, address inequalities, and work towards a sustainable and equitable future for all. Considering that the IPCC concluded that climate change will lead to greater risks of injuries, disease and death with increased warming due to more intense and frequent extremes, meteorological and climatic events such as heat waves and fires, the recommendations in the Commission's paper to reduce health-related climate overshoot come as a timely and important contribution, considering the looming risks of climate overshoot to affect vulnerable populations, in particular, increasing social and economic inequalities. In this regard, the World Bank estimates that climate-driven health effects could push 44 million people into extreme poverty, especially in Africa and South Asia, thus increasing even more the vulnerability of these people to the impacts of risks. There is ample evidence that the burden of climate-related health risks falls most heavily on less industrialized countries that have contributed least to the problem and that have less capacity to properly adapt to climate change. Assuming adaptation takes place would reduce the projected magnitude of risks. The Healthcare Without Harm and the ARUP estimate that the health sector makes an important contribution to the climate crisis, with around 4.4% of total greenhouse gases. Europe accounts for about 5% of the total carbon emissions in the region, and Germany contributed to 5.2% of the country's total greenhouse gas emissions, and G20 countries accounted for around 75%. But despite the relevant contribution of the health sector to the total greenhouse gas emissions, only 0.5% of multilateral climate funding is invested in health protective projects. Hence, current investments are insufficient to meet the scale of the challenge. The Commission policy paper provides key strategies to strengthen health systems, to build climate-resilient health systems that includes assessing and mitigating climate risks within healthcare, integrating climate resilience into primary healthcare, and implementing climate-informed health surveillance. The investments must focus on low-carbon healthcare systems that stabilize and reduce greenhouse gas emissions. At COP28 last year, we saw several advances in addressing health, including the Declaration on Climate and Health signed by 125 countries, and the first ever Health Day organized by the COP28 presidency. And this was done in collaboration with WHO and other partners. At COP28, finance providers mobilized an initial tranche of $1 billion for climate and health solutions. So we see that enhanced efforts and greater attention is being directed to health and the potential risks of impacts that climate change can have, in particular to more vulnerable regions and peoples. So with that broad introduction, I would like to compose our panel. So I'm going to call them up to come here to the podium. And I will start with Carlos Alvarado Quesada. Carlos was the former president of Costa Rica. So Carlos, yes. Yes. I don't know if Vanina is with us. Vanina, thank you. So Vanina Laurent Ledru is Director General of Foundation S, the Sanofi Collective. Thank you very much for being here, Vanina, as well. And then we have Dr. Gordon Liu. Yes, thank you very much. Distinguished Professor and Dean of the Institute for Global Health and Development at Peking University. And finally, we have Shirmei Chung, which is a member of the Youth Engagement Group, a group of 6 contributors to the Commission. So thank you very much for agreeing to be here. And let's start. I think it's going to be more interesting than my introduction here. But anyway, let's start to do that, really quickly. Okay. Okie dokie. I'm going to put this here. So I'm going to start with some questions. As a matter of fact, we have, put together some questions to the panelists. But when we start talking, outside, I talked to Shirmei. I didn't have the opportunity to talk to Vanina and also to Gordon. And allow me just to say, your names without any titles. And then when we started to talk on the margins of this meeting and going away from the specific questions, we see that there is such a range of things that we could address and that might be of interest. One of those, Carlos and I went a little bit beyond what we thought would be interesting questions to ask, to go beyond including migration as a driver for the health being a driver for migration. We also talked about the solar radiation modification, where we stand. So maybe we're gonna, explore a little bit those. But Carlos have been a formal head of government, and obviously someone who has been a policymaker, development at local levels, national, international. My question to him would be if he sees that health could be here an element that could influence the current trajectory in terms of emission reductions, adaptation, and carbon removal. So can we think of health being a driver for us to be much more actively doing what we expect to do now, which is reducing emissions, adaptation, and carbon removals, which is in the policy paper, as I have mentioned. So Carlos, it's on you. I'm going to make one question and then we come back. But if anyone feels that Carlos has touched the point where they think that they could provide a valuable contribution, please just say, hey, here, and I'll give you the floor as well. So, Carlos, it's on you.
Thank you very much, Thelma, and thanks to the panelists, and thanks you for being here. I'll try to make 3 brief points related to the report. First have to do with opportunities and risks. Let's go first to the positive of opportunities, to start with the bright side. In 2019, in Costa Rica, while I was in office, we launched the first decarbonization plan after the Paris Agreement. And then there was lots of backslash, people saying this is going to destroy the economy. So an independent study went there to make the quantification of the impact of decarbonizing the Costa Rican economy. And it actually demonstrated that decarbonization brought approximately $41 billion in net utility for Costa Rican economy. But what was one of the key drivers of that utility? It was health. And this is a great opportunity. Decarbonization is a good driver for benefits on health. Costa Rica, for example, but that is very similar in the developing world, one of the main reasons for children to be in hospitals has to be with respiratory disease or problems. Decarbonization helps reduce that and mitigate that, and that's very important for our health systems. So that's an example that there are opportunities of using health as a driver for good change in health, in lives of people, and in climate. Obviously, there are also the risks you mentioned. I mean, we don't have to go too much there because we see it today with hurricanes, Hurricane Milton, and all the impacts that comes in the US. We see it with fires, as we've seen it. Currently, I have this terrible feeling with Brazil, what's going on with fires. We see it, we even see flooding in the desert of Morocco. So that's what we're talking about, and this is not, we are figuring a world to come. That's here already. All of those happening while we speak. So then the first recommendation, that it's kind of obvious, but it's not because it's not happening, is phasing out fossil fuels. That needs to happen for environmental reasons, but also for health reasons. Because not phasing out fossil fuels, it's what's getting us into this. So those are risks, opportunities, and risks regarding this topic. The other one has to do with reform. And you will say, why is it that a health topic is related now with financial institutions and reform of financial institutions? Well, it's because we need to make change to adapt in climate. We need to address SDGs. We need to, all of this transformation, addressing poverty, hunger, health systems, costs money. But most of the developing world do not have the fiscal margin to do this. So we need all this change, but we don't have the enablers to make that change happen. So a driver in this case of not improving health systems and climate, it's the lack of healthy finance for countries to do that. So that's why one of the recommendations there, that not only the finance and the environmental, but the health community should be aware of, it's the reform of institutions that provide finance. That has to be central to what we do. By the way, this could be connected also, for example, we saw it in an emergency recently, like the pandemic.
Yeah.
To address that, you need finance. I was a pandemic president, and I can tell you, you need finance, and your income goes down while that happens. So that it's something for a health community to be aware of its importance to. It has a determinant impact on health. Reform of financial institutions. And my third point will be trust. We talk about trust, and we need to build global trust. And it's needed to achieve this in facing fossil fuels. Trust, global trust is needed in the sense of reforming institutions. And we also saw it, for example, on the pandemic, how trust plays, international cooperation and trust plays a role. Because science, Thelma, you that are a scientist, and you've been in IPCC, but in other fields, know science delivers for humanity, giving vaccines, but not necessarily public policy. We need to build trust back again to address all of this. And that will be my first approach to why this intersection between health, risk, and climate overshoot is essential. And we need the voice of the health community on board to make this change happen.
Perfect, thank you. And then I would like you to start thinking on a couple of questions that I will have later for you, which is basically how this policy paper could help overcome some of the issues that you have raised. And then I come to Vanina. It's a really pleasure to come with you. And Vanina is working on, she's from the Foundation S. And so you have been working on, she's director of Foundation S, and you have been working on advancing climate and health solutions finance. That's most likely not very easy to do.
No.
And then I will raise one of the issues that in my introduction I briefly mentioned. 90% of the countries have included health in their nationally determined commitments and disease. But only 0.5% of the multilateral climate funding is allocated to projects that explicitly address human health. So I have a couple of questions to you, Vanina. First, why is it so difficult to implement or to provide financing in a broader scale? What are the barriers, for instance, for developing countries? Is it lack of good projects? Is it the risk of investment? And I know I'm challenging you with some elements here. And I think that Carlos has mentioned something interesting, trust. So I mentioned that COP28 has advanced, several donors putting together the idea of having this higher contribution for health purposes. But we have seen initiatives before, like providing 100 billion per year for, developing countries to advance their adaptation mitigation purposes, and we didn't see that concretely happening. And so what happens is that dilutes the trust. So do you think that this could be something that we need at the level of the Climate Change Convention to bring back? And what is needed for that? And then I'll come to another thing, which was the report that was launched at UNGA last September.
Yeah.
But I would like you to please address this question before we go to that one.
Okay, perfect. Well, thank you very much, Thelma. Thank you very much, everyone, for being here. I know we're competing with lunch, so I think, same as Carlos, I'm very appreciative of everybody's time and commitment to this topic. So, Thelma, you mentioned I head Foundation S, which is the philanthropic organization of Sanofi, a healthcare company. And the reason I'm mentioning this is because it is critical for us to be in the field of climate and health, because it is impacting everything that a healthcare company or a healthcare company foundation is doing, and that is to provide healthcare to those that need it. That is the mission, and that is critical to place it front and center. So you asked several questions, and I'll also want to say that I'm very pleased, and in case you've not seen it on your chair, here's the report that we all have been collaborating on. And it's critical to remind a key point. When you invest $1 in health, it yields $4 back in economic returns. You've seen it during the pandemic, how health is wealth. It's not a new study, but it is worth reminding ourselves sometimes that don't let healthcare systems crumble because they're hit by a hurricane or cyclone or heat wave. It just costs much more to rebuild them. And it is, at the end of the day, the best investment that you can make also in development. So once this is said, you also alluded to in your introduction, Thelma, to the fact that COP28 put $1 billion in commitment to climate and health, that there was the first health day at COP. This was followed by the first World Health Organization resolution on climate and health. So we're seeing an interest there. Yes. We're seeing that finally the climate community and the health community are somewhat coming together more and more. But what we're seeing as well is that there is still a staggering $366 billion, and it costs me a lot of words just to say it because the number is so big, in finance gap between the current annual funding for climate adaptation and the need. But let's not be spooked by this number, because even though the pace of the crisis is rapidly outrunning adaptation efforts, we see so many solutions being developed left and right, and again, some of them are in the report. So I think what I'll mention in response to your question on barriers. Well, barriers, I'm not going to spend too long on outlining them, but clearly the fact that there are still silos between the climate funding, the health funding, the fact that at local level, communities are often not at the table. I was giving an example in another session. We've been partnering with an organization in Bangladesh, and we found out that in the Barguna district, one cyclone shelter was built on the wrong side of the Char of the river. And when the cyclone hits and when floods hit, the population could not use the cyclone shelter. So that is why it is so important to have communities at the table every step of the way. Otherwise, we can devise the most beautiful funding schemes, but if they're not going to be helpful, then what good is it to anyone? So, and maybe the last barrier I'll mention is the fact that we need to ensure that at the end of the day, numbers don't mean anything. And the reason I'm saying this is, it's very easy to say, of course, but it's because numbers are just too big at this point in time to get us started. And the reason I'm mentioning it is because at the end of the day, health is about hope, it's about resilience, it's about wealth. And the minute people understand this, then the funding flows. Then you see that the investment is going in the right places. So it's not about taking this $366 billion finance gap and see, okay, how I'm going to put 1 billion here, there, and maybe I'll get to 366 in 200 years' time, because we don't have 200 years.
Yeah.
So that's why it's so important to ensure that we move past those barriers and fast-track flexible financing. And we'll get to that in the second part.
Yeah, thanks, Vanessa. You know, one fear that I particularly have is that what we are doing in terms of anticipating, you said there is a finance gap. But this finance gap here is being estimated based on what we have currently, needs and so on. However, as time advances and potentially the overshoot that is going to bring a greater risks of impacts, I think that this gap is going to amplify, right? Because most likely, let's take, for instance, the case of Brazil. We have had unprecedented floods in the south. We have had unprecedented droughts in Amazonia. And we have had unprecedented fires. And this has increased the number of people that had to rely on health systems, especially for pulmonary diseases due to the smoke. So potentially we are not even prepared for that, right? Because you have the elderly, you have the children, all of a sudden you have, especially if we are talking about, not São Paulo, which is a big place, like Rio de Janeiro, well prepared, but you're talking about, areas in the north east of part of Brazil, north part of Brazil. Brazil is huge. So I mean, this is challenging, and every time we are facing more and more challenges to make the health system inadequate to all. But we will come back to this, and thanks for addressing the barriers as well, Vanina. And I will come back to the report that was released by the foundation. Gordon, it's a pleasure to have you here. And Gordon is a professor, as I said, at the Peking University. And the issue that I want to address with you, you come from a developing country, I come from a developing country, Carlos comes from a developing country, Hong Kong. So we are massively represented here from the developing country's perspective. But obviously, I think that a lot of effort has been put on mitigation of climate change. Obviously, mitigation of climate change is key, continues to be key if we want to be on a track, on a trajectory, let's say, emissions trajectory to limit warming to 1.5, if we set that as the Paris long-term, goal. However, as has been already acknowledged also by the stocktake that took place in the Climate Change Convention, adaptation is not anymore a choice. Adaptation now is an urgent need. So on top of mitigation now, we have to have adaptation being taken care of. And we have a huge adaptation gap, because most of the investments have been made for mitigation purposes. There is a gap in terms of adaptation. Adaptation is much more complicated, because when we think about mitigation, most likely you know how much emission reductions you are going to have from energy, from waste, from industrial processes, from agriculture. But how about adaptation? Adaptation, I'm going to adapt to what? What level of warming? And that brings an enormous challenge. So I would like to, from the perspective of developing country, how can global finance systems be reformed to better mobilize climate finance that addresses both public health and economic resilience? And how can developing countries, your opinion on how can developing countries also participate to this gap in terms of adaptation? How is, not only from your own perspective of the university, but how do you see China looking at this issue of adaptation?
Thank you so much. It's my truly great honor to be invited to participate in this panel in the very last minute. But it's never too late to join the panel. In order to engage developing countries to participate in this kind of dialogue and possibly come up with the financing condition to fight against overshooting climate conditions, I think we need to know why we care about it. Even though this issue, the climate change issue, has been discussed intensively in developed countries for years, I think, and it's based on my observations in my home country, ordinary people may not think this is as urgent as it should be. So let me offer you at least two reasons why do we need to care from developing countries. This is very crucial in order to have them to join you. We care for ourselves, not for others first. Why is that? My hometown in China is in Sichuan province. In the past, I was educated in Chengdu city, Sichuan province, when I was 20s. I grew up there. I worked over there before I went to the United States for study and work. In my memory, we never have had such a heat wave as we had last year and especially this year. My relatives, friends called me back in the summer that in Chengdu, Sichuan province, had, believe it or not, over 40 degrees Celsius for almost a week. That never happened in our history. So this is not the issue that is something that developed countries are talking about. It's something just right next to you, period. We care for ourselves. China contributes about 18% of global GDP. But because of relatively low efficiency of GDP production, we contribute more than 18% of global CO2 emissions. So China has every reason to join this effort. Now you ask, for developing countries like China, how can we come up with the financing? I think if we know the cost of continuing the way we behave, the way we conduct our production, the way we conduct our consumptions, we know we would have to pay more cost than if we change our trajectory, period. So it's not something we would pay more. We would pay less if we change the way we finance the different projects. For example, subsidy to coal industry, for example. So that's number one issue. We care for ourselves. Number two, we care for the poor. As you said, when heat wave came, the poor, believe or not, would suffer the most. Think about someone like me. I'm a professor of economics at PK University. I can either stay in my home, I don't go to school, or I go to office, enjoy cool air from air conditioning. I don't have to deal with the heat waves. But most farmers, most truck drivers just cannot wear air conditioning clothes. We don't have that technology yet. If there is one, that would be too expensive. They have to deal with the heat waves, literally any moment when they have to work, not us. So in this sense, if we join the efforts in trying to contain the temperature by doing many other things, the poor benefit more than the rich because they are in very, very tough conditions. Okay? Number three, how do we do it? Well, this is very, very complicated task. It's not easy. It's easy to say, but it's more difficult to do. But at least I think I can think of two specific ways that we may, work together. Number one, as I mentioned earlier, in many countries, including China, okay, historically, the government has one way or another subsidized heavily to power industries. Okay? Historically, there was strong reasons why government would do so, because otherwise the heavy industry cannot function at the higher cost of energy. So in order to have economic growth, many governments can do much about it, but to subsidize power industries such as coal, mining industry, electricity industries, they know there would be problems with the emission of CO2, pollutions, things like that. If we had reasons to do that in the history, the conditions change. Now the equation is turned around. When we see more and more pollutions, more and more climate changes against the human health. So we have more reasons to stop or to reduce government subsidy to those industries. We would benefit from it, right? For example, as you just mentioned, when the heat wave came, we see the number of visits to hospitals increased dramatically. You're going to pay either out of pocket or government finance. You would save if we have better climate conditions. So it's not something on the paper where it's real world situations. You would have much better option, okay? Number two, if we want to make our efforts as recommended by your commission paper to be taken seriously by many stakeholders, many countries, first, I will be happy to help translate that into Chinese and distribute in China, by the way. We probably need some kind of coordinated system that would be accessible to the world, where the world communities can check where they stand in the reference systems which can measure human health, animal health, climate change, pollution conditions. Without such a coordinated system that would allow the world community to quantify their locations and also assess the risk of their location against the planetary boundaries, I think our work would be less productive, less efficient. But where there is such a system that would allow the world community to be more coordinated, to be more productive, my research team at PK University has initiated such an effort, unprecedented, late October 2023, called Planetary Health Access, or PHA system, which is aimed to build a coordinated system that would allow the world to track their current position in the three-dimensional system: human health, animal health, and environmental health. And then, furthermore, to allow them to assess the risk of their current position against the planetary boundaries. With that system ready, available, I think the world can be better coordinated for the efforts to get your task accomplished.
Yeah.
I hope we can someday to have the system shared with you maybe next time.
Yeah.
Watch the PHA system development. We're going to launch the PHA system very, very soon. Look forward to it.
Yes.
Thank you.
Thank you. Okay. So please, can you please tell me when we are 10 minutes to close? Because then if we have a chance, we will open the floor for questions. And then we go to Shirmei. And Shirmei is one of the 6 members of the youth engagement group that provides independent feedback on the deliberations of the Commission to help ensure that the Commission includes diverse youth perspectives in its analysis. So it's a great contribution that we have here. And I have the chance to talk very, very quickly with Shirmei, and we were talking about a couple of things. First, Shirmei works with some communities. So the idea is how ready are communities to understanding the challenges of climate change, the risks of climate change, in particular to health, and if they are thinking more in terms of mitigation, or they have already embedded the need for adaptation. And then I also want you to address one question that we see recurrently coming into play. When I talk to the youth, and in particular when the media says, we have already reached the 1.5. This is why I wanted to make this differentiation. When you have a monthly estimate, oh, it's already 1.51, so what can we do? We already overshoot. So we are already expecting, much higher risks and impacts on health. And then when you look at other estimates, so we first need really to harmonize the idea of where we stand. But we are looking to have that harmonization. But when I talk to youth, and because the media are exploring this, well, we reached 1.5. We reached 1.5. We exceeded 1.5. They say there is no hope. Because all the science was saying is that, when you get there, you're going to have much higher risks than you have at present. And the observed risks, not only to health, but to ecosystems, to the functioning of the sectors, agriculture, and so on. All this is being impacted and felt and observed now. If I take the last number of the IPCC, it's 1.1. IPCC didn't come up with, with where we are now. This number was 2019, but I would guess that we would be around 1.2 something. So when I talk to the youth, they say, I think there is no hope anymore. And this is affecting them because they see no hope for the future. This is bringing the mental health issue on the table recurrently, not only for the youth. I think it's coming, especially when we are feeling all these unprecedented extreme events. It's unprecedented everywhere. Professor, you just said, unprecedented higher temperatures. Everything is being unprecedented now, and to a velocity that we did not anticipate. And so, Shirmei, I want you to touch on this, to have your, talking to the communities, the youth. What are the perspectives of the youth? How are they tackling or leading, with this issue of mental health? And if depression is really something that is on the table for the youth, and especially the lack of hope for future generations, and, and a view that the present generation is not doing enough. Yep.
First of all, thank you so much for having me here. I feel extremely pressured to speak for an entire generation. But I'll try my best based on my personal experience. I think I really echo Professor Liu's sentiments about people who are most vulnerable and people who are poor are the most affected by climate change, but then they know the least about climate change. And this is something that I see firsthand coming from a working class family in Hong Kong. They, to this day, still don't understand the kind of work that I'm engaged in. They do know that I occasionally speak in conferences, but for example, there is no exact translation to the work that I do in Cantonese, my mother tongue. So my parents still continue to think I'm doing something related to recycling. And they're like, why are you all the way in Germany doing this work? Why can't you just come home? So there is definitely a lack of knowledge in communities, but I think that's really changing, especially in the last 5 years. The reason why I pursued my studies overseas is I did my undergraduate degree in environmental studies, also in the States as well, because it was at a time when climate change was not a main topic in Hong Kong. But now we see that there are academic programs being offered, community-based education, climate change being embedded in class curriculums. So there is change going on, but it's frankly not enough. So I have been trying to engage more in this public policy space. Now I'm doing a master's in public policy to try and bridge that gap. So previously I did a lot of work in community, but now I'm trying to engage more in the high-level forums to really understand how politics and policy works, which actually comes to my next point and to answer your question. There is a lot of despair amongst people in my generation. The feeling of having no hope, people around me having mental health struggles, feeling like they don't have a future because they frankly don't know what the future holds. Earlier in our conversation, I also mentioned that a lot of people that are my age now do not want to even start a family, not because they don't want children, but because they feel like it would be an irresponsibility to bring people a new generation into this chaotic world right now. However, even though we are in despair, we are also very eager. So just 2 days ago, I had the privilege to participate in a side panel. There is a youth side program organized by the German Medical Association, and I spoke with a lot of fellow youth people. It really brought a lot of energy within me to continue this kind of work. And a lot of them are very eager and in the medical field, in the public health field, but they don't know how or where to start. And I think this echoes to President Caseta's point about trust. How do we build trust? Well, I feel like you can only build trust by bridging this gap between the older generation, the younger generation, and this is through empowerment. And what I mean by that is that when what we offer is fresh perspective, community level engagement and responses, and what you can offer to us is your expertise, your guidance to us on where to start, how can we be involved, how can we have a seat at the table to make decisions. And I think, for example, today earlier, I got to also attend a meeting with Jennifer Morgan, and these are people that I study, but people that I have not interacted with. And I think the interaction matters because then it gives us hope that our opinions do matter and that we can make a change and that there might be a future for us. Yeah.
Okay, great. Very good. So I'm going to have a very quick round. No, not yet. I'll come to that. We have 10 minutes, but I'm going to go 1 minute for each one, just to cover some issues that I still think that we need to elaborate a little bit. I'll go to you, Vanina. I mentioned that last September at UNGA, there was a launch of a report. And I want you to talk a little bit because it was from risk to resilience, right? Unlocking climate finance for local health and adaptation. If you could, briefly, I would say if you can do that, bullet points, 1 minute.
Yes.
I would love it.
First of all, I'm very thankful for my fellow panelists because I learned a lot, and I think I'll give you the conclusion before speaking about the report. My key takeaway is really that I think we have the action here, but now we need agency and investment, so action, agency, investment to really accelerate the community-led adaptation. We focus on resilience, on making sure that healthcare systems are more and more resilient in the face of climate. So on top of this report that you have on your chairs, indeed, Pascal Lamy, who is another climate overshoot commissioner, sits on the Climate and Health Council, which is the think tank of Foundation S. And this think tank has produced a report to fast-track flexible financing for communities to adapt. We have heard how communities are really on the front lines of this climate crisis, and one figure, we are expecting 1 death every minute, that is 1 death a minute by 2050 from climate change only. So it's really the sense of urgency that we have here right in front of us that led us to issue this report to ensure action can be accelerated. Break the silos. I think the professor, you explained this eloquently. Ensure that we can also accelerate philanthropic funding. Today, only 2% of philanthropic funding goes to climate. This is not the right percentage. We are pushing philanthropy to get to 10%, and I'm hoping that next year at WHS we can have 10% of philanthropies funding going to climate. And the last thing is making sure that you can adapt funding requirements and develop common schemes. So we are seeing this, for instance, through development banks and other. Thank you.
Perfect. Thank you, Vanina. So I'm rushing a little bit now. Shirmei, I want to come back to you. Very quickly, 1 minute. So how can the youth be better engaged? And if you think that the engagement with the Commission brings another hope to the generation, that there is hope. 1 minute.
I think often we're told that we still have so much to learn that we're not ready to have a say in things. But I think we're running out of time. And frankly, there needs to be more fresh perspective in the involvement of climate change issue. We need an intersectional approach. And my simple answer would be to get us involved in your decisions, not just to, for example, have not just a side program where students can participate in these conferences, but also a seat at the table where they can speak, where they can contribute their opinions, where they can have an influence in your policy paper.
Yeah, thank you. Carlos, you're a commissioner. So on you, what is the value that you see with the commission work? And if you think that, all these, the care agenda, and in particular, we didn't touch, and I don't think we have time to go to the RE of the care agenda, which is the issue on removing CO2 from the atmosphere and also exploring some technologies like solar radiation modification. What is the I am not pushing you to, in 1 minute, wrap up on this, but feelings on the policy paper and how much it contributes to awareness.
I will stress in the need for urgency with examples. I'm doing now some work with Pacific Island states. And it's expected that some of the Pacific Island states, nations, in the United Nations systems, are going to disappear, like Tuvalu, like the Marshall Islands, like Palau, because of sea level rise. This is the urgency that we have. So that's why on the first recommendation, phase out fossil fuels is still urgent. And I will not get tired of repeating that. That's the first. But also thinking on the small states, like Tuvalu or Costa Rica or even Singapore, small states. Small states gather, states less than 10 million people, it's like 700 million of the world's population, but they are the most vulnerable ones. Why do, just addressing briefly the topic of solar radiation modification, briefly, 1 minute. This is a technology that can only be developed by big countries. And my urge to this is the exploration and the collaboration, but to have governance to whatever outcome is, to never have this being used unilaterally. This has to be, even consider, has to be used on a multilateral framework. God forbid, or your beliefs forbid, that this is used unilaterally. Just a small thing. Small countries, not responsible of this. Some in the verge of disappearing or migrating. And on top of this, using geoengineering without having agency to say a thing. So I think that's why it's critical to build trust, to put that on a multilateral setting for discussion, in both governance and research.
Okay, so let me go to the participants, and I think that might be Professor Gordon, just excuse us so that we can go to, if you have your question very much targeted to whom you are addressing the question. I have a hand that is here for a long time, and then I'll come to the ladies. Please be very, very focused on your question and to whom you are making the question, please.
I am Dr. Aditya. I am a physician, adult vaccination. I specialize in adult vaccination. I am from India. I just want to say a few things, just 1 minute. Climate change, like Shirmai Ma'am has told, it is an emergency, global emergency. It should reach to the grassroots level. We, in collaboration with Harvard, we were doing a research on the climate change in a diabetic patients. We were using continuous glucose monitoring and to see how is the diabetic fluctuation occurring. Because in diabetes, glycemic variability is important. It will cause the complication. We have seen in the morning and in the summer season, HbA1c was increased by 2 times, more than 2 compared to the adults. And one more thing I want to emphasize is, we are a social animal. In climate change, whenever we are thinking, not only humans, even the animals also should be included. Even the animals. Because we are a spider web and everything should be included. And my third thing which I want to ask the Shirmai ma'am is, how the thought process is very good. We should decrease the bridge gap between the experts and young scientists, because the older generation, the expertise which they bring, younger generation can't understand at the onset. The more urgently they understand, it will be better, because you are the lighthouses for us. And we want younger generations also to have more representative. How can younger generation can be more representative at the international form? Like grassroots workers who are there. Like I came from an underprivileged country, like a low socioeconomic country. How can our voices be heard by the experts of you is my question.
Yes, thank you. And Shirmay, I think that you responded more or less to the question of how the youth can get more engaged, not only nationally, but internationally as well. I had two hands from young ladies. Let's go in sequence. This one, and then your hand, please.
Hi, Shirmay. Sorry, I probably mispronounced the name, Shirmay. Just wanted to ask, as a young person in my 20s who was a policymaker for 3 years, I was constantly talked down to. My experience didn't matter. I hadn't been there long enough. I just wanted you to perhaps share the practicalities of what it involved being in the youth reference group, so that people in the room perhaps could gain some insights into how to operationalize youth engagement. We hear a lot about youth engagement, but if you could talk about, we met X number of times, we gave this kind of input, this was the iterative process, I think it would be really amazing to hopefully inspire others to do similar initiatives.
Yeah, okay, thank you. And then the lady on, yes. If you can be very targeted and focused. Thank you.
Yes, thank you very much. So I'm Dr. Abiodun Egwenu. I'm from the Nigeria CDC, a field epidemiologist, and now in charity on my PhD. My question is to Carlos. I really like some of the comments you made, but the first point you made was phase out fossil fuels. From some low resource settings, some of the economies are actually built on fossil fuels. So I just wanted to know, what are your thoughts around the policy options that we should be looking at? And also, what alternatives should we start driving towards? So when we're advocating, like I work in the space of AMR, so climate is a big issue, the One Health space, driving resistant infection. So what should we do differently in such settings?
Okay, thank you. So, Shirmay, can you address? And if people want also to get Shirmay after, we finish this panel, you're welcome to do so as well. Shirmay, can you address some questions?
If I understood first your question correctly, it's about the how I was involved with the commission. Is that correct? Yeah. So as I said, coming from like a working class family, I think I just got shot into the multilateral forums out of nowhere. So I'm still like kind of learning. And honestly, in the beginning, I was very shy, but I think that shyness actually worked in my favor because I took the time to really understand the dynamics of what is going on with the commission, outside of the commission, and also with like discussions in climate change topics. In terms of input, we had been invited to a commissioner meeting in Nairobi when they were deliberating the launch of the report, their first report. And in anticipation to that, we as the youth engagement group actually had an independent report with a set of recommendations for the commissioners. And one of them being later adopted by the commission is a moratorium on the exploration of solar radiation modification across the world. I also have the opportunity now to speak in these forums like today. And here I continue to echo, the importance of like youth engagement and empowerment. And through like, putting myself out there, then I got also invited 2 days ago to this youth side program to also interact with peers like me. Like, I think it's important to not see yourself as somebody who's inferior to, especially the older generation, that you also have like value and power within you, and that you have a seat on the table, and you should have a seat on the table for a reason, because you have a perspective that they don't have. And yeah, I think it's a question that I ask myself a lot and I continue to reflect on, which is why I think it's very important to build community, and especially among the youth, to collectively kind of feed energy off of each other to continue this fight. Yeah.
Okay, and then thank you, Shermay. We see from the questions the interest on the youth. And Carlos, can you address the question on phase out of fossil fuels?
Yes, and I'll try to do it briefly, but I think we need to address phasing out fossil fuels with empathy. And what do they mean? Because phasing out fossil fuels, it's a phrase that synthesizes an objective, but not everybody departs from the same position. So many countries, their livelihoods and developing countries depends on fossil fuels. Yeah. So it's not as easy to say as because of time, you just say phase out fossil fuels. But that's why I add that with empathy. What does that mean? We need to cover this pathway, cross this pathway, this journey together, in which we manage to phase out fossil fuels and provide sustainable livelihoods for people, which is good obviously for climate, but for life and for health in the process. So it's not just a matter, in that empathic definition, of phasing out. It means we need to, if a country's exports is 25% fossil fuels or 65% fossil fuels, and its income as a government comes from 90% of fossil fuels, and you just say phase out, you're giving them a condemnation. So that's why I will add, and perhaps I should be learning that and saying always, phase out fossil fuels with empathy. That's with understanding of the other. Perhaps that's what one thing that we lack a lot in this. One more piece of thing. When we talk about this, one of the things I learned is there's lots of dualism. There's north and south, there's east and west, there's developing and developed. We miss that piece in what we are all together in, integrated in, because it's one planet, it's one home. It's not us and them in that scenario. So how to do, and the empathic approach considers us being a joint community as one.
Okay, very good. Can we have 2 minutes to wrap up the panel? Yes, okay. No, so I'm asking only. Okay, so I'm going to give each one of the panelists 30 seconds or at most 1 minute to wrap up. And I'm going to start with Professor Gordon.
1 minute.
Yes.
Well, once again, I want to repeat. We care about climate change for ourselves first, for the planet we share, and most importantly, we need the radar screen to tell us where we are and where we can go, how far we can go. With those instruments available, I think we can do a better job. Thank you.
Okay, thank you. Vanina?
Thank you. So since I had a foundation, I'll stay on the topic of financing, noting that it's not just about financing. Fast-track flexible financing for communities. Only 10% of climate funding reaches local communities. We can all do a better job.
And Carlos?
I'll just say thank you all for being here. And keep acting. That's what we need. Action. Every small action matters.
Yes, definitely.
So let's act.
Yeah. Okay, that's great. And Shermay?
Yeah, sure. I think power lies in the individual. I think we tend to forget that. And if you are one of the people who are not self-identified youth today, I think mentorship and guidance really matters. If it wasn't for my university for encouraging me to apply to be nominated in this commission in the first place, I wouldn't have even applied and I wouldn't be here today. So your mentorship and your guidance really matters.
That's fine. Hey. Well, it's very unfortunate that we have to come, at the end of this panel discussion. I was very honored, to have these 4 panelists with me. And I hope that this session has been enlightening, that it has brought some contribution, and in particular, awareness of the concerns of the youth generation, of how China is looking on addressing the issues, and then finance. I think that we covered a broad range. I hope this session has been very useful to everyone. Thank you very much.
Thank you.